Dizziness. Causes, symptoms and how to care. Dizziness is the vibe of discombobulation, or the inclination that you may drop. Dizziness might be joined by queasiness and regurgitating, sweat or a nervous perspiration, awkwardness, and swooning. Blood supplies oxygen to the mind. Dizziness happens when blood isn't getting to the mind rapidly enough, or if there is a shortfall in the measure of oxygen in the blood. Unsteadiness can be brought about by orthostatic hypotension, a drop in circulatory strain after you stand, hunger, regular sicknesses and diseases, like colds, hypoglycemia, low glucose, drying out, heart issues, or sensations of uneasiness and frenzy. More genuine aims of discombobulation incorporate extreme dying, coronary episode, and strange heart rhythms. People with dizziness are at high risk for traumatic fall injuries. The vibe of things twirling around you, causing you to feel shaky or wobbly, is known as vertigo. And numerous people may depict this indication as tipsiness. Vertigo is most generally brought about by a condition known as generous positional dizziness, labyrinthitis, aggravation of the internal ear, Meniere's infection, inward ear illness that influences equilibrium and hearing, headaches, and diminished bloodstream to the cerebellum, the lower segment of the cerebrum that is associated with control of equilibrium. Feeling bleary-eyed and lightheaded can be indications of a possibly dangerous condition, for example, a coronary episode, stroke, or stun, extreme drop in pulse. Seek immediate medical care in the event that you experience dizziness joined by sensations of torment in your chest, discourse issues, disarray or loss of cognizance. For even a short second, trouble breathing, extreme stomach torment, serious cerebral pain, uncontrolled dying, abrupt shortcoming or deadness on one side of the body, or changes in vision. What other symptoms might occur with dizziness? Dizziness may accompany other symptoms, which vary depending on the underlying disease, disorder, or condition. Disequilibrium. Fainting or change in level of consciousness or lethargy. Shaking or trembling. Other symptoms that may occur along with dizziness related to other body systems including chest pain or pressure, cool or clammy skin, difficulty hearing, headache, nasal congestion, nausea with or without vomiting, numbness or weakness of the extremities, profuse sweating, vision problems. Serious symptoms that might indicate a life-threatening condition. In some cases, dizziness may be a symptom of a life-threatening condition that should be immediately evaluated in an emergency setting. Seek immediate medical care, call 911, if you, or someone you are with, have any of these life-threatening symptoms including chest pain or pressure, convulsions or seizures, difficulty breathing, talking or swallowing, high fever, higher than 101 degrees Fahrenheit, loss of consciousness, severe abdominal pain, severe headache, sudden weakness or numbness on one side of the body, vomiting. What causes dizziness? Some basic reasons for dizziness include hunger, weakness, hypoglycemia, low glucose, or nervousness. Wooziness can likewise be brought about by neurologic conditions, like various sclerosis, Parkinson's illness, and epilepsy. Dizziness. The impression of moving or your environmental factors moving around you is related with aggravations in the vestibular framework, which oversees balance. Since your ears are related with this framework, ear contaminations and illnesses, like Meniere's sickness, can influence your feeling of equilibrium and walk. Benevolent positional dizziness influences the internal ear and happens when you change the situation of your head. Labyrinthitis as a rule follows a cold or influenza and is regularly brought about by a viral disease of the internal ear. Serious causes of dizziness can include heart attack, stroke, or shock, all of which are severe. Potentially life-threatening conditions that warrant immediate medical care. Causes of lightheadedness. Alcohol or drug use or intoxication. Allergic reactions. Anxiety or panic. Arrhythmias, irregular heartbeats. Decreased levels of breathable oxygen, altitude, carbon monoxide exposure, etc. Hypoglycemia, low blood sugar. Infections or illnesses, such as the cold or flu. Medication side effects. Mild dehydration. Causes of vertigo. Alcohol or drug use or intoxication. Labyrinthitis, inner ear infection. Medication side effects. Meniere's disease, inner ear condition affecting balance and hearing. Positional vertigo, dizziness that occurs when shifting the position of the head. Neurologic cause. Neurologic causes of dizziness. Brain hemorrhage. Brain or inner ear tumor. Infection of the ear or brain. Migraine. Multiple sclerosis. Parkinson's disease. Serious or life-threatening causes of dizziness. In some cases, dizziness may be a symptom of a serious or life-threatening condition that should be immediately evaluated in an emergency setting. These include brain hemorrhage, myocardial infarction, heart attack, severe bleeding, shock, stroke, transient ischemic attack, temporary stroke-like symptoms that may be a warning sign of an impending stroke. Common questions people have about the various dizziness causes include: why am I dizzy after eating? There can be a few reasons you feel dazed subsequent to eating. This incorporates postprandial hypotension, low circulatory strain subsequent to eating, and receptive hypoglycemia, low glucose inside 4 hours of eating. Food sensitivities and liquor can likewise cause discombobulation after a dinner. Why am I dizzy after standing up? In the event that you get unsteady subsequent to standing up, it's most probable orthostatic hypotension. Another name for it is postural hypotension. It occurs because of your pulse dropping when you stand up from a sitting or lying position. Why do I get dizzy when lying down? If you get dizzy when lying down, it's most likely related to your vestibular system. Specifically, it could be BPPV, benign paroxysmal positional vertigo. Only your doctor can advise you for certain the thing is causing your dizziness. On the off chance that you have any of these inquiries, see your primary care physician for an intensive assessment. Home remedies for dizziness. Avoid alcohol, caffeine and tobacco. Drink plenty of fluids to stay hydrated and avoid overheating. Get an adequate number of hours of sleep each night. Improve safety at home by removing rugs, applying no-slip strips to floors, keeping cords out of the way, and installing grab bars in bathrooms. Sit or lie down if you have an episode of dizziness and avoid standing up or moving suddenly. Use a cane or other assistance device to maintain stability while walking or standing. What are the potential complications of dizziness? Since dizziness can be because of genuine illnesses, inability to look for treatment can bring about genuine inconveniences and perpetual harm. When the particular basic reason for your dizziness is analyzed, it is significant for you to follow the treatment plan that you and your medical care proficient plan explicitly for you to decrease the danger of potential difficulties including brain damage, heart failure, loss of hearing, loss of vision, paralysis, spread of cancer, spread of infection. Dizziness treatment depends on the underlying cause. This may include medications or balance exercises. If you are experiencing persistent or recurrent dizziness, it's vital to see your doctor to get a diagnosis. Self-treating dizziness without seeing your doctor first may delay the diagnosis of a potentially serious medical condition. Thank you for watching.